Good afternoon. Welcome to Club W, Physical Activity for Women, presented by some experts from our physical therapy department from North Kansas City Hospital. I have Britta, Michaela, and Kelsey here, and I'm going to turn it over to them to introduce themselves and tell you a little bit about their expertise and get into our presentation. Thank you, ladies, for presenting today. And I did want to just let you know that we are recording the presentation to be put on the North Kansas City Hospital YouTube channel for your further viewing and to share with other family, friends. And also at the end of the presentation, we'll be doing a question and answering period. So if you have questions, just put them in the chat box and we'll get your questions answered for you. Thank you, ladies, for presenting.
Okay, hi everyone. So I'm Britta and I have Michaela and Kelsey beside me. And like Sandra said, we are all outpatient physical therapists here at North Kansas City Hospital. So to give you guys a little background on who we are and what we do every day, we're all doctors of physical therapy. So we went through a 4-year bachelor degree and then a 3-year doctorate program on top of that, where we studied movement pretty much every single day. So we know a lot about how the body moves, how the muscles and the bones interact with all the other systems. And this is what we do every day. So we work up here in the hospital with the outpatient department. And every single day, our main goal is we work with people rehabbing them after some kind of an illness or injury. So we're different from personal trainers, whereas a personal trainer may just help somebody who wants to get stronger or who wants to establish an exercise program. We work more with people who are coming back after some kind of illness or some kind of injury, working back towards like their prior level of function, so where they were before this injury. So we consider ourselves experts on movements because we do it every day. So physical therapy, just in case you've never been to physical therapy before or haven't heard of it, we wanted to kind of explain it to you guys before we started on this presentation. So physical therapy involves a thorough movement-based assessment. So every time somebody comes in, we aren't just kind of talking and listening, but we're looking at how they move and what they're doing when they move, and if there may be any compensatory patterns or anything like that that they need to work on. So all of our goals are tailored to our patients' needs and to the outcomes of this assessment that we do when they come in. So we do different tests to determine the level of dysfunction or any impairments that they may have when they get here within their musculoskeletal and nervous system. And then we work with doctors, occupational therapists, speech therapists, nurses, and all kinds of other different disciplines. That way we're all collaborating and giving the patients the best care that we can. All right, so today we're talking about the benefits of physical activity, specifically in women. So some of the things we're going to go over today, we're going to talk about endorphins, mental health, bone density, the increased metabolism, improved sleep patterns, pain management, nervous system desensitization, and flexibility. So these are all benefits of physical activity that some you may have heard of and some you may not have. So we'd like to go through all these with you. So the first one is endorphins. So endorphins are basically the body's feel-good chemicals, and they are released every time you exercise, whether you know it or not. So these are natural pain relievers and natural mood boosters. So when you exercise, even if you're only exercising for like 20 to 30 minutes a day, your body releases these endorphins. So some of the things that endorphins do, they help reduce pain and discomfort. They increase pleasure. They reduce stress, depression, and anxiety, help reduce inflammation in your body. They improve your mood and boost self-esteem, and they help support a healthy immune system and support memory and cognitive function. So a lot of people have heard of endorphins, but we don't really know what they do. But this is a whole list of different things. So even if you do a workout and you're like, well, I don't feel great, I'm not feeling that self-esteem or that mood boost, there are a lot of other benefits of endorphins too that you may not even feel. Another benefit of physical activity is your mental health. So again, when you exercise, your body releases endorphins and serotonin, and these are the chemicals that go straight to your brain to help you feel good. And it gives you a sense of accomplishment. So no matter how long or intense your workout is, you did it. I mean, it's better than just sitting there. You're getting out and you're doing something. So it doesn't matter how small you start, at least you're doing something. Some other benefits for your brain health are improved cognitive function and reduced anxiety and depression. So both these endorphins and serotonin help with those. So exercise too, it can become a social connection if you have like a group workout that you do, or if you just have one workout buddy. If you're outside, it gives you, vitamin D from the sun, gives you fresh air. So there's so many more things rather than just the chemicals released from your brain. All of this can be helpful with your mental health as well.
Another benefit of physical activity is,
oh, hang on, sorry.
We might be frozen. There we go.
There we go.
Another benefit is bone density. So this is especially important for women because women start to lose bone density as early as 20 years old, which means it's important to strengthen your bones at any age. Resistance training is not the only kind of exercise that increases bone density. Any weight-bearing exercise is beneficial. So some examples of that would be standing, walking, jogging, squatting, push-ups against a wall, or really anything where you feel your feet or your hands touching the ground, putting weight through them. Increasing bone density can prevent a fracture later in life, and it can help decrease the risk of osteoporosis or osteopenia. These are terms that you may have heard before. Some of you may have even been told that you have osteopenia or osteoporosis. Osteoporosis is a medical condition in which the bones become brittle and fragile from loss of tissue. Typically, it is a result of hormonal changes or deficiency in calcium or vitamin D, and it can cause the increased risk of fractures. Osteopenia is less severe. It's a decrease in bone mass, but it can progress to osteoporosis. So exercise is a great way to help reduce your risk of these. Another benefit is increased metabolism. Aerobic exercise, or anything that gets your heart beating faster than normal, increases your caloric burn and helps you to increase your metabolism during exercise, and it can aid in weight loss. It is important to note, though, that it may be common for your appetite to increase as your physical activity increases, and it's important to make sure that you are eating a balanced meal and providing the correct nourishment to your body. So we recommend speaking with a registered dietitian for some diet or nutritional support. Exercise is also great in improving sleep patterns. It's a great way to burn off energy throughout the day, and it improves your ability to fall asleep and stay asleep at night. As a result, you feel more rested and energized throughout the day, and it can help to decrease daytime sleepiness and improve alertness. Proper sleep plays an important role in mental health, metabolism, and general gut health, and it can lead to increased motivation for further exercise. Another benefit of activity is pain management. So movement helps to strengthen muscles and bones, which can help to alleviate joint stress and strain. However, pain is subjective to each individual. Everybody's different, and your exercise plan should be tailored to you and your specific needs, which means it is okay to modify an exercise in order to fit your specific abilities and your goals. Exercise should not cause pain. If it does cause an increase in pain, you may need to modify it by either decreasing the intensity, performing the exercise in a smaller range of motion, or take breaks as needed. So no pain, but soreness is normal, and it can be expected for about 24 to 48 hours after your activity. Soreness can sometimes mean tenderness to touch or feeling like your muscles are fatigued with movement or just in general throughout the day, but it should be tolerable and you should be able to continue with your daily routine. Moderation is key here, and the phrase "no pain, no gain" does not apply to every situation. So just to repeat what I said earlier, exercise should not cause an increase in pain. Rather, you should just feel the muscles working during your activity. Exercise can also help with nervous system desensitization. By appropriately increasing the intensity of exercise, you can improve your brain's response to pain. It's important to send positive messages to the brain while you're exercising for long-term improvement in brain health. Positive messages include things like praising yourself for completing an exercise and viewing muscle soreness as an accomplishment for your hard work, not a form of punishment. Studies show that movement can help to decrease chronic pain by re-educating the brain and strengthening connections between the brain, the nerves, and the muscles, which can lead to improvements in chronic pain regardless of tissue changes. Can also decrease the risk for further health issues. So exercise assists in lowering blood pressure and can improve circulation to strengthen your cardiovascular system. It can be beneficial for type 2 diabetics by helping to aid in insulin's ability to work. So if you have already been diagnosed with type 2 diabetes, you can help to manage this through exercise. Helps to reduce the cravings of smoking, which does have significant long-term effects on body healing and general health. It helps in lowering LDLs, which are considered the bad cholesterol, and HDL, which is the good cholesterol. It can help with controlling weight gain and preventing obesity. And it can also help with balance. Strength and aerobic exercise can help to reduce the risk of falls by working on balance and functional strengthening. A lot of our jobs and tasks throughout the day kind of aid in some poor posture and decreased overall flexibility. So for example, you may have noticed some increased stiffness after sitting for a prolonged period of time at work or during one of your hobbies. It's really important to get up and stretch these muscles every day. Improving flexibility can help to reduce pain, improve functional mobility, and aid in good muscular and joint health. And these flexibility exercises can be performed sitting, lying, standing, really in any position. It's very important to incorporate this, like I said, every day during your exercise routines. Some examples include yoga, whether it be chair or traditional yoga, stretching, foam rolling, or any type of leisurely walk or movement.
All right, so how to begin. We've talked a lot about why exercise is important and how it impacts your body, but one of the hardest things for most people to understand and to realize is how to actually start exercising and to make it most beneficial for you. Everyone's a little bit different, so we have to kind of tailor these things to our own individual needs, and so that's why this part is so important, is to understanding how to start, when to start, and where to start. So ACSM guidelines. ACSM is the American College of Sports Medicine, and so they kind of give us some general guidelines as to what we should be doing on a daily basis. Now, these guidelines don't necessarily apply to everyone. Like I said, where you start is going to be different for each individual person. So while it says on here, that healthy adults ages 18 to 65 should participate in moderate intensity aerobic physical activity for a minimum of 30 minutes 5 times a week, that doesn't necessarily mean that that's going to be most appropriate for you. So some of the examples listed below, like for light intensity specifically, we're talking about walking at a slow, leisurely pace. That for one person may be different than the next person. So that slow, leisurely pace for you may be actually a moderate intensity exercise. It might be something that gets your heart rate beating faster, it may, or improved, and it may be different depending on the person. Vigorous intensity activity is the same way. So it tells us that if we're going to try for vigorous intensity aerobic activity, we should do that for a minimum of 20 minutes 3 times per week. But once again, that is dependent upon the person. If a brisk walk is what gets you breathing heavy and unable to carry on a conversation, then that's what we would consider vigorous activity for you. So even though these are guidelines and such, they're not a standard norm for everyone. So just kind of keep that in mind as we're going through some of these things too. Also, when we're talking about guidelines as far as moderate intensity exercise, we need to remember that we're trying to strengthen big muscle groups as we're doing this. So you want to involve major muscle groups like your quadriceps, your hamstrings, your biceps, bigger areas of your body, and even your core. So balance training can also be included in this for anyone that needs it. Like Michaela had said before, balance can help decrease fall risks, or working on improving balance can help decrease fall risks. So that's definitely something that if you're in the fall risk category would be helpful for you. Like I said, movement is important no matter what you're doing. So the first step in doing this is getting up and actually moving. I think that's the hardest part for everyone, is to just start moving. But I think we've repeated this enough to say just getting started is more important than anything else. Okay, so a lot of misconception in assuming that in order to be active, or in order to exercise and be physically active, you have to go to a gym. That's not necessarily true. We've provided some examples for you guys of ways that you can be physically active without getting a gym membership. Sometimes gyms are a little scary, especially if you're, a newcomer to exercise. And so even just, a leisurely walk in the park, we want you to at least try to, get your heart rate moving a little bit, get that increase just a little bit, but still taking a walk in the park is definitely a form of exercise. You can also use your living room or an open space at home. I mean, there are lots of different things that you can use that may be helpful for you. So, chairs, stairs, resistance bands, getting a stopwatch or a timer to help prolong that activity, an exercise ball, even a can of soup or handheld weights. So to explain the can of soup a little bit more, basically that's just an example of how everyday things that you have in your house can be considered weight. So it doesn't matter what you use as a form of weight. Weight is weight. Your body doesn't know the difference. So use what you've got. Exercise doesn't have to be expensive. For more vigorous activity, you can go outside. You don't have to, it doesn't have to be vigorous to be outside, but if you're wanting, to run or jog or whatever that may be, outside might be the better option for you. One of the options that maybe some people are unaware of is something called silver sneakers, and that's through Medicare. So if you are an individual who uses Medicare insurance, this may be an option for you. It is a no-cost gym membership that's designed for seniors. You can check online and see if your specific insurance covers silver sneakers. Some of them are no-cost gym memberships, some of them are just a lower cost, and there are certain gyms that will accept these. So you may have to, check around too and see which location closest to you is going to be take silver sneakers. So that is definitely an option. And then aquatic-based exercise. So oftentimes, a lot of people like to use the pool as a form of exercise because it makes you feel good. That especially when you're in a warm water pool, that warmth on your joints can make you feel, a little bit better. And the benefits include decreased gravitational pull, and then also weight-bearing forces on your body, nervous system desensitization, and overall relaxation. So a lot of times you don't necessarily feel like you're getting the same benefit when you're in the pool until you get out of the pool. So keep that in mind. Try definitely, if you're starting with aquatic-based exercise, try not to overdo it the first few sessions because it is a little bit more taxing than we may realize. So how to start? Find your reason. Everyone has a reason as to why they want to be more physically active, whether it's to lose weight, whether it's anything that you want. You just need to find a reason and stick to that. So find something that motivates you. Start small. Walking is the easiest way to begin. We've talked about walking quite a bit. Walk in your house, walk in your driveway, walk around the neighborhood. You don't need a park or a track. And it's better to start low and kind of work your way up and gradually work into these things, as opposed to, trying to walk 4 miles the first time you go for a walk and then being really, really extra sore the next day, So start small, work your way into this stuff, and set goals for yourself to make yourself, that you can achieve, essentially. So you don't want to try to do more than what you're capable of. So be realistic with yourself. Make a routine. So schedule it into your day. A lot of times you hear that people just don't have time for exercise. 20 to 30 minutes a day is definitely achievable, especially when it's not every single day. So just make it into your routine. The more often you do it, the more frequently you do it, the more likely you are to stick with it. And do something you enjoy. If you don't like to run, then don't run. Do something that is fun to you. That's how you, keep yourself accountable too. So like I said, set goals and monitor your progress. It feels good to see results, and everyone wants to see results, but you have to keep in mind that doesn't happen overnight. You have to be realistic, like we said, and it takes 6 to 8 weeks in order for us to actually see true strength gains. Even in the clinic here, I tell a lot of my patients to make sure that you set small goals as well as big goals. You don't want to only to say, hey, my goal is to lose 50 pounds. That's a great goal, but you have to lose 5 pounds before you can lose 50 pounds, right? So keep those things in mind. We don't necessarily exactly stay encouraged when we haven't reached a goal in a long period of time. So we need to find something that encourages us to continue. Find an accountability partner. So someone that that cares about you, that's willing to help you stay committed to what you're doing. That does not necessarily mean that someone has to exercise with you, but someone that's going to ask you, hey, have you done your exercise for the week? Have you done what you need to do to better yourself today? Remember, doing something, no matter how small it is always better than doing nothing. So even if it's not exactly what you set out to do that day, it's still better than doing nothing. Increase your activity over time. And I think we've alluded to this quite a bit, but like I said, begin with low intensity, gradually increase from there in the frequency and intensity. We know that the ACSM guidelines tell us to do, moderate intensity exercise 5 days a week for 30 minutes. That may not be appropriate for you. So if you can't do that, if you need to start with 2 to 3 days a week, that's still okay. Just because that's the guideline doesn't mean that that's set in stone for everyone. So that is okay. And then make sure you stay hydrated and nourished, especially if you're exercising outdoors. You want to make sure that you're not sweating too much and then not replacing that. But then at the same time, making sure that you're hydrated the day before, the day after, any time around that period of exercise. We recommend eating before and after a workout, carbs and proteins to kind of help with your metabolism and kind of make sure that you're using your fuels efficiently within your body. Modifications to exercise. So exercise can be performed in sitting, lying, or standing. So it's definitely okay to modify. That is probably, if you take nothing else away from this section, know that it's okay to modify, it's okay to start low. Those things are very, very important. If you experience pain or you need further guidance, definitely talk to your doctor about it. See if you can get a referral to PT. And we deal with all kinds of conditions all the time. And so if you need some help, some guidance, we're here for that. If you're unsure, ask someone. And it's especially important if you're, taking medications that you're unsure about whether or not you should exercise or at what intensity or how they're going to affect you when you exercise. Definitely ask your doctor about those types of things too. Like we say, there are many ways to exercise. Find something that you like and do it. Some examples of different types of exercise include Pilates, resistance training, Zumba, jazzercise, swimming, water aerobic sports. Those are just some. Anything that you want that's going to get you physically active, that's a form of exercise to you. So just do the best that you can to keep moving. So these are our references. So I know it's not a very long list, but a lot of what we've given to you guys today is from our background and our knowledge of what we tell our patients every single day. And so these things, not to say that we didn't learn them from some sort of reference, but a lot of this is stuff that, we've just kind of picked our own brains and figured out what we think is most important to share with you guys in this specific section. And so I know that some of it may be a little bit more comprehensive than others. So we're definitely welcome to any sort of questions that you guys may have that we didn't cover in this section.
Thank you so much for that presentation. It's very informative. I do have a couple of questions here that people have sent in. Somebody asked, is there any one type of exercise that is better than another?
I don't think so. It depends on what's right for you. So if you are someone who's wanting to get stronger, then maybe resistance type exercise is better for you. If you're someone who wants to improve your aerobic capacity, improve your endurance, then maybe a longer distance walking type exercise program is better for you. It really depends on what your goals are. So there's not necessarily one thing that's superior to the next. It's just kind of individually based.
Okay. The next question is, I haven't exercised for many years. Where should I start?
Start small, like we said a couple times, is, you know, it's one step at a time. Don't go out and expect to walk 4 miles tomorrow. But like Kelsey touched on, is set these small goals. Maybe a 5-minute walk down the block and back is a great spot for you on day 1. See how you feel the next day, and then increase it step by step.
And do some research too. You may be able to look online and see if there's classes for beginners in your area, or if, you know, the hospital may have other resources as well. We have a fitness center here, I know, with personal trainers that would be willing to work with somebody who hasn't started exercising or hasn't exercised in a long time. So there's a lot of resources available to you too. It's just kind of may take a little bit of research on your part, looking for the right places. But like Michaela said, any kind of, even if you're just doing a little walk back and forth, that's something to start. And once you're moving and you feel comfortable and confident, and you're like, okay, I'm ready to try a class or try working out with somebody, then again, kind of go on and see what's available in your area.
And the more you try, the more you do, the more you'll find your niche and find what you like and what you enjoy and what kind of makes you spark. So any of those things, you know, like classes are a great way to get started with that too.
I'm happy that you mentioned about the fitness center here at North Kansas City Hospital, because a lot of people don't realize that the fitness center is open to community members. It's just not for employees. It's open to the entire community to join. And there's a really nice pool here. We do have a lot of warm water classes that are available for patients with or people with arthritis and joint issues. That really we have personal stories that people have told where they couldn't hardly walk, and then after taking these classes, where they're more mobile and they have a better quality of life after attending these classes. So I'm glad that you mentioned that. I do have some more questions here that somebody has asked. Somebody said, do I have to have a doctor's referral before starting an exercise program?
So you do not have to for a typical exercise program with a personal trainer. The difference there is if you would be doing physical therapy. So to come see us, at least in the state of Missouri, you do have to have a doctor's referral. But again, that is because we are working, you know, on someone who has some kind of pain or dysfunction or something with their exercise, who's not necessarily just wanting to start working out. But for just activity in general, you do not need a doctor's referral.
If you're unsure about anything though, you know, if you have any sort of illnesses or things like that, that you're kind of unsure of how you will respond to exercise, it's always worth it to ask the doctor and just to follow up with them and make sure that things will be okay once you kind of get started. But like Britta said, you don't necessarily have to have one. So.
Hey, thank you. And then somebody wrote too, I'm in my 80s. Is there an age that's too old to exercise?
Never. You can always start. The most important part is just moving, right? So it does not matter how old you are, how young you are, just get going.
And I think you guys kind of touched on that too, about it doesn't matter your age, your size, your mobility, just move, get the body moving. Another question is do I need any special equipment to exercise?
You can be absolutely creative. Anything you've got at home, like we mentioned, even a can of soup. Typically that weighs about 1 pound. So that could be a good gauge to do a couple of exercises. I would recommend wearing some sort of closed-toed, closed-heel shoe, just so that you're not going to trip if your foot slides out. But other than that, use what you've got.
All you need is your body. You just need to move your body. Your body is a great way to use body weight to do things. So
Yeah. One more question that's on here is, how do I know how much activity I should do every day? And I think you guys kind of touched on that, depending on how you feel the next day, but how does somebody know where to start? I think that's what they're asking.
I guess that's not really a super easy question to answer, because like we say, everyone's a little bit different. I would start small. If you know that you haven't exercised and, it's been years since you've really formally exercised, start small. Like Michaela said earlier, go for a 5-minute walk, start there. If you go for that 5-minute walk, you wake up the next day, you don't feel anything, you're not sore, you feel great, then go for a 10-minute walk, just kind of gradually increase. But starting smaller is always better in that situation, so that you don't overdo it and cause potential injuries.
Yeah. There isn't one more question that came in. Will physical activity help reduce any of my illnesses? And that could mean about anything.
Depends on what the illness is, but yeah, we touched on there can be a lot of benefits for the heart. It can help reduce blood pressure if maybe you're struggling with hypertension. It can help to increase the efficiency of insulin for diabetics. So again, without knowing exactly what you're going through, physical activity can play a big role in reducing some of those things, and kind of helping you to live your best life and with your highest quality of life.
Okay. Well, I appreciate your presentation today. It was very informative. I think we got a lot of great information. And again, thank you very much for your time for presenting. And I think that's all the questions that we have today.
Great.
Thank you, guys.
Thank you.
Okay, you're welcome. Have a good day, everyone.